I was actually at another institute for treatment of my cancer, non-Hodgkin's lymphoma, and I knew that a realistic part of having chemotherapy is that you could end up in heart failure, and the risk is low, but it can happen and it's very real. While I was at the other institute, I really kept feeling like something was wrong, something was wrong. My heart, was building enormous amounts of fluid. And I was discharged from there, went home, and just one more pillow after another I'm sleeping on. And I finally said, I have to go to the A-team, which I knew was DeBakey, and I needed to be here at this institute to be evaluated to see what there was. And I was in true heart failure with an ejection fraction of 28, 29, somewhere in there. So that's how it really began, and I spent a week with the team, a little over a week with the team, and I'm here now.
I was diagnosed with heart failure April of 2014, and what prompted me to go see the cardiologist was because over a 6-month to 1 year period prior to that, I just started having very gradual symptoms like fatigue. I couldn't exercise quite as long, but they were so gradual, so subtle, that it took me that long just to realize that something was not quite functioning the way it should be. The biggest cue was the fact that I used to go out and run. I used to run a lot. I'd go out 5 or 6 miles, and gradually over time it got down to the point where I was struggling with just 2 miles. And so at the time, I think I was just entered my 40s, so I was thinking the typical, I'm at the middle age stage and maybe I just need to cut down type of thing. So actually I switched my workouts to doing more short, intense workouts, and I was doing really well with that, but it was still just this persistent fatigue. And then also even at rest, I would find that I would feel the heart skipping beats. And then that's when I realized that something wasn't quite right from a heart standpoint. And then there's even a couple times I felt a little dizzy or even a little lightheaded.
So 40th birthday, had a nice relaxing morning in bed, reading a book. Started not feeling well. I was 6 weeks pregnant, and I thought maybe, I'd never been pregnant before, so I thought maybe it was pregnancy, I just needed to eat. And it just got worse and worse to the point my husband took me to an emergency center, and they said I either had a stroke or complex migraine, which we all assumed it was a complex migraine, young, healthy. So I had to go to the hospital, get an MRI, and they confirmed it was a stroke. Later that evening, they told me it was because I had heart failure. It was hard to put the 2 and 2 together. It was supposed to be a happy time. It took us 5 years to get pregnant. We had only known I was pregnant for 9 days when I had my stroke. We did in vitro. So, yeah, it was hard to comprehend everything that was happening. The first night I was diagnosed, a doctor had already told my husband that I would have to terminate the pregnancy. I found that out later. We got a second opinion. We went to Cleveland Clinic, and they put us in touch with Dr. Park, and she and her team were willing to take our case on. So there were, of course, medications that I couldn't take because of the pregnancy, but we found a regimen that worked, and it didn't really get too bad until my 3rd trimester.
It is a tough diagnosis to have, but realize that it's not a time to retreat or a time to feel defeated. It's a time to now stand up and fight for the life that you want to have. It's very easy to succumb to the thoughts of having this severe disease, but at the same point too, every day is a gift, and you want to live the best life you can. In order to do that, it requires now some careful, daily, work in order to have that. And that's what I would say to anybody dealing with heart failure, is that having a quality of life that you want to have is definitely attainable.
It's not all doom and gloom, because that's where I was heading when I first. You're angry and you're mad and you're all of these emotions going on at the same time, and I think it's very natural.
You would be amazed at the inner strength that you have, that we all have in us. It's there in all of us.
My name is Cheryl Krafft.
I'm Wayne Brewer.
I'm Kathy Kurtz.
And currently I'm in heart failure.
I do it with heart failure.
And I am living with heart failure.